It's the December 16th episode of Health in 2.0, and Matthew Holt has started his transformation into full-on Kris Kringle Santa Claus mode. Look at him. He's got a list of who's been naughty and who's been nice. Stay tuned. Okay, so you also have a list of who's got money.
I guess
money flying around still at this point in the year, don't you think?
I guess a lot of people were pretty nice to somebody because a lot of checks got written.
Yeah, it's amazing.
One we didn't cover, which was Bright Health, right, which is a public company getting a $750 million infusion from Cigna, because I think they're interested in their new health subsidiary, which is managing medical groups. So you're seeing all the health plans starting to sort of muscle up towards, Optum obviously is the leader here, buying a lot of medical groups, but a lot of health plans getting into the delivery system side of things. And I also had I had Bill Taranto and Sunny Kumar, both venture capitalists, on THCB Gang last week. And I would say, well, how come these private valuations are so high and the public ones are so down? They said, maybe the public ones will get bought by some of the private ones. So there might be some interesting stuff going on there. And
you were starting that rumor. Like, who would take out T-Doc? I
don't think T-Doc's top of the list, but there are plenty of them.
Why not?
Well, there are plenty of them with valuations. T-Doc's still worth $15 billion, even at.
I'm surprised Amwell's not getting scooped up by
Well, Amwell, but also a bunch of others, who are worth
Hims.
$1 or $2 billion. Yeah, those guys, they're all way down. I mean, Oscar was down tremendously. So yeah, there's a lot of interest, I think, in figuring out what happens to those public companies and do they just stay private for longer. The more people stay private for longer because the stock market's not viewing them with favor. But
Oscar, the plan I wish I could have gotten on the exchange.
All right, well, perhaps it's time to actually start this and get going.
Let's do it.
Yep.
All right. Cadence gets $100 million, brings their total up to $141 million. They came out of stealth in August. Matthew, what do you think?
Yeah, this is money from Koatu, whatever that fund is, and General Catalyst had money before. They still have LifePoint as their customer. This is very curious to me because you now have $1 billion valuation of this company, whereas Best Buy bought Current Health for $300 million, we found out, which was a competitor, which seemed to have done more. So there must be something clever going on here that I don't know about. It's RPM. It's a big deal.
All right. Innovaccer gets $150 million, brings their total up to $375 million, valuation at $3.2 billion. Mubadala Capital led this one with a whole bunch of existing investors, including Tiger and a bunch of other new investors.
Yeah, I mean, so they are doing the data integration where if you have multiple different EMRs in your system, you can integrate them all together. They've also got a bunch of other customers doing stuff with health plan and data ingestion, and they've got Zeus Health,
Pharma.
And they share. I think it's chairman was Zeus Health, right? Isn't Bush their chairman, or certainly on the early investors? And you did an interview with them, which people should go listen to.
Yes, we unpack the whole cloud single patient record space. All right, Connect RN gets $76 million. Cerveta Capital Management led this. What do they do?
This is another nurse staffing agency. We've got Nomad.
Another one.
Incredible, a whole bunch of them. So there are about shortage of nurses, and somehow a community full of nurses is going to solve that problem, maybe.
All right. White Hat Mental Health Space, Ophelia gets $50 million, brings their total up to $64 million. This is interesting to me.
Yeah, medication-assisted therapy for opiates. Hard to do. Very interesting as to how they've structured this. Whole bunch of people in this space. They're in it, Work It, Cadence, Bicycle Health, Eleanor, whole bunch of them. They've got a very clever way of getting the part-time prescribers onto the platform. I don't understand how it works, but very cool.
All right, what about Apti Health? They get $50 million, brings their total up to $65 million.
Yeah, this is another in the mental health space. This was a couple of weeks back. Takeda Digital Ventures led this one. This is, they're aiming, a little unclear, but they're aiming at sort of doing high acuity mental health. Some of the health plans and helping primary care docs sort of refer to them. A little hard to tell exactly what's going on there, but there's just so many different flavors of mental health online company that you saw the one before, right? Which is medication assisted therapy for opioids. So many different flavors of this, and you've got some really big players. Obviously, Headspace Health, which acquired the Ginger acquisition. You got Lyra, bunch of others. I mean, there has to be a market reckoning here. By the way, Talkspace still available, $300 million market cap.
Did you that article in The Economist that was pointed out to us by Jeff Goldberg?
Oh, yeah.
Did you read the whole thing? I didn't get a chance to read it after you sent me the copy that we borrowed.
I mean, there's a lot going on, right? They're talking about
what was it about again?
Well, there was a couple of things, right? One, does any of it work? And the other one was there was a Finnish mental health company, kind of Finnish equivalent of Talkspace, where there was therapy back and forth that got hacked. And all of a sudden, the hackers had access to people and what they'd written in the text back and forth with their therapists, and there was a whole bunch of blackmail and other stuff going on. So they were suggesting really that we need, as we know, that you need better data, better understanding of what works and what doesn't work, and we need to have better. But look, we've needed that forever anyway, right? In the real world of therapy, we know what happens. We also need better understanding of whether the drugs work or they don't work. If you think about, a Cerebral raised all that money. Mostly because it's been accused of overprescribing medications. We're going to find out a lot more in the few years coming.
I think this is going to be like a main storyline for next year. Don't you? I just feel like, how can it not be? I mean,
on the other hand, we know the demand is off the charts, right? And you make it easy access. People want both the therapy and the medication. Probably going to need some combination of both going forward. But it's a wild, certainly interesting. This is my alarm.
Thank you, extra timer Rooster, for coming in.
Back, starting up again. I don't know why that happened. We went on another 2 minutes.
Oh, that's nice. I like when that happens.
That's so good. So
JP Morgan canceled. Did you see that?
Yeah, JP Morgan.
Last little bit of gossip that we've got here.
Well, how am I have to pay for my own drinks in early January?
What is this?
I don't know.
So tired of this COVID-19 world.
Well, because people won't get vaccinated.
I just get my hope. I almost feel like though, it's like it gets my hopes up, and then it's like, oh, we're not going to do it. Like, I wish we wouldn't wait so long to just decide not to do it. Like, I know we got to give it a shot, but it's like a couple weeks, and then it's like, oh.
I think Omicron is really, people are worried about it. The good news from I was reading Eric Topol's tweets the other night. The good news is that if you have the booster, it's pretty good.
Oh, I saw that too.
If you only have the regular vaccination, it's much better to be vaccinated than not be vaccinated, but it's still spreading pretty quickly. And there is definitely an uptick in hospitalizations and definitely an uptick in infections. In fact, in the UK, I know my sister has it, my nephew has it.
Oh no!
I mean, mildly, they're all vaccinated, but it's not great, right?
Here in Florida, still no masks.
Yeah, but Florida is an exception to humanity, right? In many ways, and the fact that none of you guys
I'm starting to wonder if maybe it's like Florida has been referred to as America's basement, and there are so many bugs and there's so much humidity down here that I'm almost wondering if this is the perfect environment for a virus not to thrive. There's like enough roaches and lizards to just eat these particles out of the air. I'm going to start a rumor.
I'm sure.
I know a certain governor that might be very interested in perpetuating that.
I'm sure Tony Fauci will be expanding on this very shortly. Now you
fake news coming out of Florida. Big surprise.
All right, you better get us out of here while we still.
All right, let's do it. For more fake news, follow me over there at Jess and I, just trying to survive and thrive here in Florida, wearing a mask where nobody else is. For more fun and exploits with the jolly man in the red sweater over there, you can follow him over there at Bolty Boy. All the holiday cheer that one could imagine coming out of that Twitter account. And the gift that keeps on giving, our email newsletter. You can sign up for that for free. Sign up one of your friends and surprise them over there at thehealthcareblog.com. Just hit email newsletter and subscribe. Fa la 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 ta da. We're done.
One more before Christmas, do you think?
Maybe. We'll see what happens.
All right.
We'll see who's been naughty and who's been nice.
I think there'll be one more then.
I think so too. All right. See you later, Matthew.
Bye.
Bye, guys.